Hi, my name is Caitlin Withers. I am a DNP FNP student at the University of South Florida, and I'm doing a case study and presentation on von Willebrand's disease. This is for the Advanced Physiology and Pathophysiology class. So we first start off, this presentation will cover patient demographics, chief complaint, presenting signs and symptoms, pathophysiology of the disease, differential diagnoses, or what can be confused as von Willebrand's disease during diagnosis, clinical manifestations of the disease, cultural and sociocultural considerations, prognosis and expected health outcome, laboratory and diagnostic studies in order to diagnose the disease, pharmacological and non-pharmacological treatment considerations, and teaching and anticipatory guidance. So we first start off the case study with the patient demographics. We have a 12-year-old Caucasian female who reports to the hematological clinic with complaints of lifelong non-traumatic easy bruising and frequent epistaxis. She also has an older sister and mother who have similar experiences. Recently, the main reason why she came in was that the patient had a recent fall that left bruises on her left lower quadrant of her abdomen, legs bilaterally, and left hip. She takes a daily iron supplement and oral contraceptive pill, but denies taking any other medications or supplements and minerals. She was recently diagnosed with iron deficiency anemia at the primary care office. She has no surgical history, but she does report that she has increased fatigue and has difficulty concentrating in school. She reports also having heavy menstrual bleeding. Her menstrual periods started at this age, at age 12. They have occurred monthly, so they are regular, and last about 8 days. She changes her pad hourly due to the amount of blood during her first couple days of her period, and she does report unexplained appetite changes and weight loss in the past 6 months. So regarding the chief complaint, some of the red flags that were brought to our attention was easy non-traumatic bruising bilaterally on the thighs and legs. Patient recently suffered a fall where there are hematomas to the left lower quadrant on the abdomen, left hip, and bilateral legs. The patient was also experiencing a loss of appetite and weight loss in the past 6 months, and heavy menstrual bleeding, which could cause her anxiety. She reports having anxiety and depression, and she sometimes stays home from school. So actually the definition of heavy menstrual bleeding is lasting greater than 8 days, consistently soaks through greater than or equal to 1 sanitary protections every 2 hours on multiple days. It requires the use of more than 1 sanitary protection at a time and associated with the repeat passing of blood clots. Some frequent signs and symptoms of von Willebrand's disease. Patients usually present with epistaxis, heavy menstrual bleeding, gingival bleeding, bruising, gastrointestinal bleeding, most often with postpartum hemorrhage. They do require acute transfusions, post-dental extraction bleeding, and then hemiarthrosis, which is more commonly shown in the type 3 of von Willebrand's disease, which is the most severe form. So here are some differential diagnoses that could be mistaken for von Willebrand's disease based on her presenting symptoms. They are ordered from highest to lowest acuity. So starting off, lymphoma or other symptoms of malignancies often present with fatigue, weakness, anorexia, weight loss, night sweats, bleeding, and easy bruising. This is a differential diagnosis for von Willebrand's disease. And also tobacco and alcohol use is an additional risk factor for malignancies. Also, regarding high-risk sexual behaviors can also be a possibility due to the exposure of HPV, which is consistent with head and neck malignancies. Often diagnostically, hematological studies such as a CBC is done, or more invasive, such as a bone marrow biopsy. The next one is hemophilia A. It is a X-linked recessive disorder that is a mutation in the clotting cascade similar to von Willebrand's disease. There are severe, moderate, and mild cases of the disease, with severe being 60% of cases diagnosed. So severe is the most common one. This disease can cause hemiarthrosis, just like the type 3 of von Willebrand's disease, and deep internal bleeding because the blood is unable to clot. So with these, diagnostically, you could do a CBC with differential, and then clotting tests such as fibrinogen, prothrombin time test, and APTT. Lupus is next, which is a chronic autoimmune disorder that has widespread effects. The prevalence is much higher in women than men, similar to von Willebrand's. Often differential diagnosis and symptoms. Findings you can find are the malar rash, which is the butterfly rash, Raynaud's syndrome, fever, fatigue, leukopenia, splenomegaly, anemia, which she was diagnosed with iron deficiency anemia at the primary care's office, and increased risk of bleeding. Diagnostically, C-reactive protein is increased, sedimentation rate is increased. They also have a positive ANA, but that shows that it's nonspecific. CBC with differential, creatinine, albumin, and a urine analysis. Hypersplenism is an overactive spleen, and due to the spleen being the main organ for red blood cell destruction and filtering the blood, hypersplenism is always secondary to a primary disorder. The findings are consistent with left quadrant pain, fever, fatigue, weight loss, recent infection, bruising, or bleeding, and then lymphadenopathy. The diagnostics that would be done to determine this disease would be also another CBC, platelet counts, amylase, bone marrow aspiration, and abdominal CT. Malnutrition-wise, she did claim that she has anxiety and depression. So findings, you would find dry skin, hair, decreased deep tendon reflexes, pale conjunctivae, weight loss, and bruising. Most often, the patients present with electrolyte imbalances. Kidney and liver function tests are done. And now we move on to the pathophysiology of von Willebrand's disease. So regarding the disease process, von Willebrand is a factor 8 glycoprotein that plays a part in hemostasis and the clotting cascade. It is synthesized in endothelial cells and is megakaryocytic. After transcription and translation, pro-von Willebrand factor is covalently linked to form dimers in the endoplasmic reticulum, then gets packaged in the Golgi apparatus. The property undergoes cleavage, and the mature factor is secreted in the vessel lumen. It functions as a carrier for factor 8 to maintain its levels and help with platelet adhesion and binding to the endothelial components after vascular injury. So during the clotting cascade, it also binds to exposed collagen during the process of hemostasis, and von Willebrand factor contributes to the fibrin by preventing its degradation by plasma proteases. With the absence or lack of this factor, that's what mainly causes von Willebrand's disease, which prevents the blood to clot or an increase in bleeding. So, clinical manifestations of this disease, according to Dew, there is a higher incidence of elderly adults between the ages of 65 to 85 with von Willebrand's disease having GI diseases. The statistic is around 15%. The median age of diagnosis of von Willebrand's disease is normally in childhood, mainly between the ages of 2 to 5.5 years old. The median time of the first bleeding event to the actual diagnosis took about 2 years. And then von Willebrand's disease is thought to be the most common bleeding disorder, affecting up to 0.1% of the population. Patients with von Willebrand's most frequently reported in this study were epistaxis. People have reported 55 to 86% of this symptom in the study, oral and gum bleeding, and then also heavy menstrual bleeding in women of childbearing age. They claimed it was between 61 to 100%. So regarding the laboratory tests and diagnostic studies, according to Dew, to facilitate the von Willebrand diagnosis, the use of a bleeding assessment tool was utilized in patients suspecting of having von Willebrand's disease, most commonly in a primary care setting to help identify if they need laboratory testing or not. So in the case study, the physical examination was unremarkable, except for few bruises on bilateral thighs. A CT was done of the abdomen and pelvis and chest, just to see if there's any signs due to her unexplained weight loss of malignancy, but that was also unremarkable. They also did a complete blood count, comprehensive metabolic panel, factor 8, prothrombin time, and partial thromboplastin time, D-dimer, and antithrombin activity, which were all normal. The only thing that raised a red flag was that her von Willebrand factor activity was much lower compared to the antigen. From reports, it was established that her von Willebrand factor activity was 20%. The normal of the reference range is 40 to 163%. Usually, going back, bleeding assessment tools are used. These are questionnaires used to help clinicians evaluate a patient's history of bleeding symptoms and assign them a score based on the severity of those bleeding symptoms. So it's kind of an objective way to score patients' severity, duration, and need for treatment of bleeding episodes. The normal score is 0 to 3 for adult males, 0 to 5 for adult females, and 0 to 2 for children. Regarding her age, she would consider a pediatric bleeding questionnaire, so it has a high negative predictive value, indicating that it was useful in identifying patients who did not require further lab testing. Regarding the types of von Willebrand's disease, type 3, like I said, is the most severe, so that's the complete absence of von Willebrand factor. So they would have the highest bleeding scores, while it decreases in type 1, and then subsequently in decreases in type 2, and then subsequently decreases in type 1. And then also you can consider genetic testing. The cost has decreased in the most recent years. And then even if patients have increased bleeding scores and unexplained bleeding symptoms, they could also benefit from a collagen binding test to explore the possibility of having an undiagnosed collagen binding defect with von Willebrand's factor. Regarding pharmacological and non-pharmacological treatments, pharmacological, the most common is desmopressin or DDAVP. It is an analog of vasopressin that causes the rapid release of von Willebrand factor and factor 8. DDAVP is more commonly used to treat type 1 von Willebrand's disease. You also have recombinant von Willebrand factor. It's synthetically produced and is another replacement therapy option in the treatment of type 1 severe types, type 2, and type 3. You can also do antifibrinolytics such as tranexamic acid or aminoproic acid, and they've been used with success to treat heavy menstrual bleeding, which she does have. Also, in the primary care office, she did receive hormonal therapy, such as an oral contraceptive or an IUD. Regarding acute problems with bleeding, such as GI bleeding or postpartum hemorrhage, you can have a blood transfusion. In the non-pharmacological, you would have to avoid strenuous work, avoid contact sports because of the increased risk of bleeding, and also providing education about bleeding disorders. Cultural and sociocultural considerations. More often than not, since she is a teenager, online communities are there for her, just to consider that she's not alone with this bleeding disorder. We also have a World Bleeding Disorder Registry, so patients can register themselves to identify themselves in the Bleeding Disorders Registry. Also, the perceived and measured impact of bleeding disorders on a patient's overall life activities, including work, school, and hobbies, is significant. Women with von Willebrand factor have reduced participation in sports and physical activity and are less likely to enroll in post-secondary education than men with von Willebrand factor. So there is a disparity there. A lack of bleeding awareness often causes symptom dismissal and are significant barriers to patient care. Multiple barriers to care exist, including geographic barriers, a lack of specialist access, a lack of bleeding, normal versus abnormal bleeding, and a lack of access to timely treatment. Simultaneously, the importance of multidisciplinary clinics have been increasingly recognized. Recent international guidelines highlight the importance of multidisciplinary teams, such as hematologists and also gynecologists to manage the bleeding disorder. Since she is having anxiety and depression, psychosocial support should be there for a consideration. And then also there are hemophilia care centers, which could be done locally, and then that could connect to resources also. Prognosis-wise, with the diagnosis of von Willebrand's disease, individuals can live a normal life. According to Dew, most of the cases in the study were of unknown cause. The only ones identified was 7.2% being carcinoma and 2.9% being a bacterial infection. Statistically, though, there is no difference of mortality between individuals with von Willebrand's disease and without. And then regarding teaching considerations, just bleeding precautions, so utilize electric razors, brushing teeth gently to prevent gingival bleeding, avoid blowing your nose too hard, do not have dental work done without your doctor's approval, increasing fiber in your diet, and do not strain while defecating. And then these are my references. Thank you for listening to my presentation. I hope you have a nice day.